stream. Well, good evening, everyone. I want to thank you for coming out today to our Veteran Town Hall here in Juneau. Certainly want to do a hearty thanks to the University of Alaska here in Southeast for hosting us. We appreciate the partnership in each and every day. Come on in.
I'm sorry, I was just saying hello because I have a meeting downstairs.
All right, fair enough. Well, welcome again. I want to talk to you a little bit about what's going on within the VA. And then, most importantly, we want to answer any questions that you have here. I have a number of people with me tonight. Our Chief of Community Care is Dr. Julie Keating, and she'll give you an update on some of the important things that are happening for our veterans who need to seek their care outside of our clinic here in Juneau, as well as Mr. John Lee, who is our Vice President for Tribal Healthcare Alliance, and he's based out of Alaska in an office not far from where we are in Anchorage, and his team is dedicated to support Alaskan veterans as a carve-out from the national contracts that represent and support the entire rest of the country. So a couple things to keep in mind coming up. On the 5th of February, we'll be bringing Dr. Teresa Boyd, my boss, who is the network director for the integrated region, we call it Region 20, which is Alaska, Idaho, Oregon, and Washington. She'll be coming up to Juneau on her way to a series of meetings that are being held in Anchorage. And so it's important, for her, one, to see the community here, the clinic that we have to support you, and then also interface with our veterans. And then we'll be hosting a Women Veterans Town Hall that same week. It'll be a statewide teletown hall, and Dr. Boyd will be participating in that as well. And the goal behind that teletown hall is to ensure that we're specifically advancing and addressing the needs of our women veterans, so that our team, from their perspective, they believe the VA is their VA, and we're supporting them appropriately. We have a number of initiatives that we've done in the Southeast specifically. One is we've added telerheumatology and teleendocrinology for veterans across the entire state. And so we partner with our brothers and sisters in the Northwest market to deliver those that care through that virtual modality. Both of those specialties are hard to find in our state, and so adding this resource increases the availability of those unique services. And so our team is adept at scheduling those for veterans who have that need, and certainly want to make sure that you're aware of that. We're in the process of partnering for the next round of our tribal health sharing agreements across the state, and I think we're getting fairly close to the finish line of having those new agreements in place. So we have another series of meetings coming up, I believe, end of next week, but I'm hopeful that we will have a set of agreements that takes us out, just like the last one did for the last 12 years. This one will carry us out into the future and be supportive of both tribal health community as well as the Alaska VA for our veterans. Certainly a partnership that we would not be able to replicate on our own if we tried so. A couple other things just to share with you. If you do make it up to our main campus in Anchorage, you'll notice that we are doing a lot of construction. And so we're adding additional mental health resources for the Alaska VA. It looks like a chaos right now because construction kind of does that. But when we're finished at the end of next summer, I think it'll be a really nice new facility to support veterans across the state. We talked at previous town halls about a couple legislative initiatives that have significantly increased benefits for veterans. The first and foremost is the toxic exposure screenings and benefits under the PACT Act. And that PACT Act creates an opportunity for veterans to presumptively have their illness or injury that they have pulled back to their military service. And so I'm going to use a great example, and I'm not going to infer that you have hypertension, but we have a Vietnam veteran here. The PACT Act today says that if you were in Vietnam, there was a likelihood that you had some exposure to Agent Orange. And if you had a likely exposure to Agent Orange, then you happen to have hypertension, the government by law has determined the nexus between that illness or injury and your government your service in the military. So you don't have to prove that the time in the military caused that. And so that's one of the huge benefits, and we have that for airborne hazards in the desert. We have that for a number of other programs. And so making sure that people do the toxic exposure screening is essential, and so that we can vector people quickly. Our friends at VBA tell me that it takes about 120 days now to process 90% or so of all their claims that they have in the inventory. It's pretty quick. When I retired in 2017, it took a little longer than that. I don't know how long it took, Daryl, for you to get your benefits, but I'm going to guess it was probably a bit longer than 120 days. And so I think the system is starting to deliver on the promise of being more responsive and more agile. So I think that's a good news story. So far, we have processed 16,000 toxic exposure screenings in Alaska alone. And I think it's important to note that we have more than 16,000 veterans. And so we need to make sure that everyone, we do that, spread the word, because we're all advocates for veterans, whether we're in the agency or we're just happen to be a veteran ourselves. And as an example, I spent 34 years in the Air Force. Why I joined the VA is to help serve fellow veterans, because that's just what I find near and dear to my heart. In companion with the PACT Act, though, there are some other legislative initiatives that are super important. For our women veterans, there's an act called the Service Act. Many veterans who do not currently have access to screenings because they never applied for their benefits, if they have exposure to a toxin that would be identified through the PACT Act entitlements, the Service Act helps with early detection of breast cancer, and it enables that benefit for our veterans. And then probably the other one that is the most expansive is the Compact Act. We have a lot of veterans in crisis across the country. This enables veterans who may not be enrolled to our healthcare system to get care if they're experiencing acute suicide thoughts, so that we can stabilize them and get them the care they need and get them back to where they need to be. So we can provide up to 30 days of inpatient services and up to 90 days of outpatient services for veterans in crisis. I'm going to invite Dr. Julie Rose-Keating to talk a little bit about a couple of the important community care items, and so I'll turn it over to you, Julie.
Sure. So just a couple of reminders. All VA care has to be pre-authorized by us, so if you get an appointment, please let us know right away so we can update authorizations with correct dates. And you can let us know that by calling our appointment line, and that's 907-257-3720. And we'll take that information and fax your correct authorization to your provider's office. I want to talk a little bit about the Traveling Veteran Program. This is a program that we've had for quite a while. We have a lot of snowbirds in the state of Alaska who like to travel from here to Arizona to Florida, wherever their winter home may be. And so what the Traveling Veteran Coordinator does within our department is help coordinate care in the lower 48 for you. What we ask is that you reach out to your primary care provider if you know that you're traveling ahead of time. Let them know where you're going to be, give them an address, and what care you could possibly need. Sometimes, we see a lot of this with like lab work, so patients with atrial fibrillation go and get weekly, monthly lab work. And so we coordinate that care within the VA system closest to where you will be, so you can get those labs and not have to worry about, do I have an order or do I have an off? And so we facilitate that for you. We can also facilitate it if you're already down where you are. Say if you're in Arizona, you ended up at an urgent care, you call your primary care provider team, you say, hey, I've seen, I need a referral, and then we can facilitate that referral at the closest VA for you. And so that just takes, like I said, a call or a secure message to your primary care provider. Let them know where you are, so that way we can facilitate the care closest to you.
Thanks, Julie. Any questions for Julie in terms of community care? All right. Something else that's really important, especially as the weather flies in. This morning when we got on the plane in Anchorage, there was 18 inches on the ground, and it was still coming. Something that we all who might get some sort of medication in the mail need to take into consideration is sometimes that inclement weather causes the mail to slow down. There are multiple ways for veterans to request a refill on their medication. As you get the medication in the mail, most of it comes from the lower 48 from the consolidated mail order pharmacy. But as that comes in, it tells you how many refills that you have left. The easiest way to do the refill request is to go on to My Healthy Vet, order the medication as soon as you receive it. The system will then make sure you get it on time. So you don't have to remember, when I get down to this much, order more. You can also mail in the little piece of paper that comes and just request it again. You can make phone calls. Whichever works best for you. I would tell you the easy button answer is do it on My Healthy Vet. And if you need assistance with the My Healthy Vet account, we have people that can help get that organized as well. But that's something that is important. In addition to that, if you have temperature-sensitive medication, think about where it's going. If it's going to be dropped off in a box on the street, probably not the best answer. Maybe arrange for that to be held at the post office and then pick it up there if that's convenient. That's a different way of ensuring that that medication isn't frozen when you get it and therefore useless to you. So just something to keep in mind. I want to invite Mr. John Lee to talk a little bit about what TriWest does for us. We have an amazing partnership with them. We are what we call Care in the Community Network 5. There's 4 regions that cover 49 states plus all the territories. And Region 5 is Alaska alone because of our unique opportunities and medical landscape. And John is the Vice President for TriWest that helps support us.
Well, thank you. I'll stand up. My name is John Lee, and I'm the Vice President of Alaska Operations for TriWest Healthcare Alliance. And I've been with the company for just over a year. I'm a retired Army officer, spent 22 years in the Army, and retired in 2006. And I've worked in the private sector, primarily running healthcare organizations for about 17 years, 13 of them up here in Alaska. And so glad to be back now serving veterans exclusively. And as Director Steinbrunner said, I shortened it, I just say Region 5. So we're Region 5. The rest of the country is Region 1, 2, 3, and 4. And the VA, in its great wisdom, I think, carved Alaska out uniquely to be its own region so that the important issues in Alaska don't get lost in the noise of all the busyness in the lower 48. And so we have the same performance standards in Alaska that all the other 4 regions have. We're measured the same way. And what my company does is we're what's called the third-party administrator for the community care network, the private sector network. And so my job and my team, all based out of Alaska, are to go out and contract with providers across the state of Alaska to be in the network as a resource for the VA and for veterans to access care outside of the VA system proper. And so when the VA authorizes and sends a referral out to the community, it's my providers that are in my network who provide that care. And my job is to be responsive to those provider organizations, make sure that they're properly educated and oriented to the program, have the right policies and procedures, and provide great, exceptional care for our veterans in the community. So that's what I do in a nutshell. And glad to be serving veterans again as a veteran. It's really cool to be serving veterans. A big part of my workforce in Alaska are veterans as well. And so glad to be providing services. Any questions you may have, stay afterwards and answer any questions you might have about our providers in the community. But thank you.
Thank you, John. Just to re-amplify, if you will, one of the points that John was mentioning, nationally, all of our contract region managers have to meet a certain number of performance standards, and that's to ensure that you get high quality care and timely support. Our Alaska population, we know that Alaskans serve at a higher per capita rate than the rest of the lower 48, but it's still a small number. And so when you blend that small number into a big number, quite honestly, we could have Alaska be blown off, and the needle on performance wouldn't change. By having a separate contract, John and his team have to meet that same standard. And quite honestly, John and his team blow the national standard out. They are far and above performance in the lower 48. So we have the best service as well here in Alaska. And I think we have an amazing partnership. John and Dr. Rose Keating, they have a bi-weekly meeting to work through any and all issues. In Alaska, there's no issue that's too small to deal with because we're here to serve veterans, and we serve veterans one at a time. So, just want to close with a couple other quick thoughts, and then open it up for your questions or your, any concerns that you might have. One of the things that we worked hard on with the telecom carrier is to ensure that when you get a call from our clinic here in Juneau, it says on your phone, if you have a readout device on that, it'll say Department of Veteran Affairs, so then you don't have to guess who's calling. Before, it all looked like spam. Looks like a number, and unless you had that number memorized, we would find that we would have a lot of missed calls and a lot of phone tag going on, and so we want to avoid that. So we proved that out here in Juneau first. We have all our other community-based outpatient clinics around the state now that it works, and we're about halfway through the prefixes in Anchorage. It's not as easy as you would think, but we're working our way through that so that when you get a call from us, you're not guessing who's making that call. So we think we're making progress there. Still room to improve for sure. And then the other thing I wanted to highlight was we have, just like everyone else, a team that turns over, but we are working to expand services here in the local community. We've increased and added a social worker who provides support for homeless veterans in the local community. We have a full-time provider here at our satellite clinic here in Juneau to support veterans in the community. And then we have a robust team that backs them up. And we're looking to add chiropractic services at our facility here in town. So with that, I'd like to open it up for any questions or comments that you might have.
I have a question.
Yes, ma'am.
Who's the new VSO? I understand there's a new VSO. It's not Ramona Wig anymore.
So Trina is the VSO that covers Southeast now, and I'll make sure that we have her information to share with everyone. The VSOs, or Veteran Service Officers, they work for their respective organizations, whether it's American Legion, VFW, DAV, Disabled Veterans, or some of the others. And those organizations get a grant from the state Office of Veteran Affairs. That money comes from the federal government to the state to establish these support organizations. And so Trina manages the Southeast. And so we make sure she is, do you know where Trina's home office is?
She's in Kodiak. I'm looking her. Is Trina M. Crimmins?
Not physically located, but she travels to support the Southeast. Okay. Now, there are a number of ways that you can get support from a VSO. Trina is one. We have support through the Alaska Office of Veteran Affairs, Mr. Bernie Bowen and Forrest Powell. The team up in the Veteran Benefits Administration that are in my building, they also do claims processing, and they can also help establish appointments. And there's also an 800 number, and if you want to, I'll actually tell you, this is an 800 number that actually works. What you do is when you call the 800 number, there's a human that answers it, and you just tell them you want to speak to the Alaska team, and they route you straight in. It's two ways to do that. If you want to look at entitlement, either filing a claim or filing an amended claim, they can start the clock over the phone for you. It's pretty easy. And then they can also schedule appointments right there over the phone and make sure that you're hooked up. And so I will share the number. You can choose to use it or not. It's 1-800-827-1000. And the team, that's an 800 number that actually works pretty good. A lot of 800 numbers, you kind of wonder where you end up.
Could you
That's one
repeat
actually.
that number?
Sure.
Sorry, hang on one second. Sorry. Okay.
It's
1-800.
1-800-827-1000. And then just ask to speak to someone on the Alaska team.
Okay, thanks.
Our VBA team in Alaska has the highest performance measures of any of the VABA teams or Veteran Benefits Administration teams throughout the country.
Thank you for calling me. If you could expand and maybe share with maybe some people are not familiar with the TVR program and how it interacts with veterans in the VA, I think that would be very helpful.
Thanks, Daryl. It's a good point. We have an amazing network unique to Alaska. They're trying to emulate it some other locations around the state, but we have a unique team called Tribal Veteran Representatives. And most of our tribal veteran representatives are tribal members, but not all. But it was designed to create a grassroots team of people who we provide training to that can be the voice that connects the VA to their local community. So, for example, if Daryl is one of our tribal veteran representatives, but let's use him as an example. If John was unsure about how to link up with the VA or even what the VA might have available to them, and they're in the same community or same area, John could get with Daryl and have a one-on-one conversation that explains how to connect with the VA and how to better be supported. And there's an element of trust that naturally comes with that community connection. Some people are just not sure how to partner with the VA.
Right.
And this is a huge benefit in terms of people who have a great tool set to help them connect with our team to get them the services that they need. So we have about 450 tribal veteran representatives. And there's a little bit of turnover that happens each year, but they're spread all over the state. Some of them are embedded in our tribal health hospitals around the state, but others are just in communities, and they provide a great support for our veterans. In addition to that, though, Daryl's taken that step one further in terms of the TREP program. And the TREP program is similar to the VSO program, or Veteran Service Officer, but it's specifically to assist our tribal veteran members at that same level of support. So there is someone who can help tribal members in a culturally competent way access and file claims. Thank you. And he's a PACE center in that across the country. This is one of those things that has been taking a bit of time to get through, and Daryl's plowed through that effort so that we have that capability here in the state. So thank you very much.
Currently, if I may add, there are only 2 tribes that are currently accredited to the VA, and that's the Navajo Nation Veterans Affairs, and then just recently, I believe it was this last June, the Gila River Band in Arizona was the second. So this is something that's still in the infant stage. And of course, we're growing because we have to work out MOUs and things like that.
Sure.
So it does take time, but it's like an added benefit with the TVR program, because if you have somebody in your community that you know, there's a sense of trust, a better understanding of that. And you mentioned also about the cultural aspect, but there are different ways of handling things so that way it's appropriate.
Yeah, absolutely.
And with this program, it's like anything. If you're not feeling well, you don't want to have to travel. Whether
Right.
If you're for 5 minutes, 3 hours if you're coming from a remote community. And that's one of the things I've noticed within the VA. I got involved, I think it was 2014, and they've been reaching out and working to connect with the veterans, which is good because that's what's needed. I think there were about 77,000 veterans in Alaska. And of course, we have an attrition rate because people are hitting their expiration date as we get older.
That's right.
And so, providing that services and networking, and I don't know, how much, where Tri-West is doing as far as the joint use agreement. Is that still a term that's used?
I'm not sure.
Okay, I can talk to you about that later. But as far as, just, providing the service, that's key because.
Absolutely. That's how, my husband is a veteran, and that's how he, did you know John Wilkins, or did you know John Wilkins? They called him Top. He used to do outreach.
Okay.
And he went all over, we used to live remote. And that's how we got connected. He took his boat out and just went to all these little communities outlying. I just ran into him on the boardwalk one day and started talking.
And that's the nice thing
But
about
it made all the difference.
in the TBR program. You get people at Prince of Wales. You got somebody in Heidelberg. You got somebody in Craig, Klawak. In Hoona. The number here in Juneau. Wrangell, Petersburg, Ketchikan, Cake.
Yeah.
That are there.
Yeah, a lot of veterans way out there.
And
they need somebody like you and Top.
Yeah, and what's important, what's important to do as we go forward is start networking better between, different VSOs.
Yeah.
Because if you're spread thin and you can't go, because, in honesty, the majority of the veterans are considered in the Anchorage area, so the services are there.
Right.
And then periodically, the VFW or American Legion may send somebody through, and that might be maybe once a year, if that. And as a result, those people in the Southeast are not connecting.
Yeah.
And that's important, because then you start feeling left out. And I imagine, it could do the same thing up in the interior, that if they're not able to go there, and so that's where, the TREP program, as that grows, it becomes more known. But it's at the infant stage right now.
Yeah.
But as that grows, the network, the possibilities are tremendous.
Yeah.
Because it would be easier to service those 70,000 plus if you divide up the pie, if you will. So now you're not overwhelmed. It's more manageable.
And then you get the network between veterans too.
Mm-hmm.
I mean, even in this time in the place where we used to live, there were a couple guys that I didn't even know were veterans until Todd came around. And, they're a third of the people who lived in this tiny place were veterans. And they're all being veterans.
And that happens a lot. I've encountered where I've talked to somebody from a village and they go, my uncle, left for a couple of years and he came back. And then they didn't find out till the person had passed away, and they're going through the belongings and go, oh, that's where he was gone. He'd served his country, but he came back a changed person, and they didn't know until the person passed away. And so that's the importance about networking, talking, because the other thing is, if you don't know the answer, maybe somebody in your network does, and so it just alleviates that stress and lessens the chance of saying, I don't know, but maybe I can go ask and somebody else might do.
Absolutely, that's great. Yeah. Huge difference.
Yeah, that's,
So to complement what I was talking about is we also have a small rural health team, and we do outreach visits around the state. Typically 40 to 50 different communities in any given year. We'll coordinate with the community to let them know that we're coming so that we can do individual notification to veterans. Some of that is important to keep the veteran information updated in the system, right? And sometimes it's a veteran who hasn't used this yet, right? So I will tell you, in Anchorage, as we were coming down, I met a gentleman, he had a nice jacket on. I said, oh, that's a nice jacket. And we just started talking, and I realized he was also a veteran. And I asked him, because my view is I'm always on duty, and I always want to know that if we're taking care of people. I asked him, do you use your VA benefits? He said, well, I haven't felt the need, but I'm kind of wondering if I need to use it. And so he and I are going to connect to get him connected with the VA. But we have to have willingness to ask the question, right? Because out of the 70-some thousand veterans in Alaska, only about 36,000 are connected with the VA. And there's reasons, individual reasons why people may not want to. Some people don't know that they have access to benefits, and so we have an active campaign, but we need the community to support us in sharing that information. Our TVRs do an amazing job of helping in their local locations. We also do, like I said, a lot of visits to support our veterans. And so when we come to town, the VA has 3 main branches: the healthcare system, which is what my team runs, the benefits team, which determine what you're eligible for, and then the cemetery service. When we come to town, we don't want the veteran to have to guess who we are. So when we come to town, we process claims, or at least get them claims started. We can't adjudicate them because that's separation of duties. But we get your claims started. If you need a tombstone for or appropriate memorial for a veteran who has passed, we process those claims instead of telling you, well, wait until that person comes in on the next plane, whatever they're scheduled, because we don't know what that is. We don't want to leave that veteran hanging. So we try to do full service, and in each village or community that we go to, there's a number of veterans that say, hey, can you help us with this for my uncle or my father or my mother? And so we're, that's what we're here for.
So if I may share on the headstones, a number of years ago, I think it might have been 2016, the VA worked with the community. It was Cape, and they replaced or installed new headstones for, I think, between 7 and 9 veterans that had essentially unmarked graves because maybe the headstone deteriorated or they didn't get one to begin with. And so that's a substantial step to bring in that many headstones and lay the headstones. And so, I've been fortunate, to observe what's been going on with the VA, because I was not involved with the VA prior to the TVR program. I retired from the business I was in, and I got invited to participate. And then I got a chance to network and meet with other people. And the other thing is, periodically for what I do currently, I may get a heads up from a veteran service officer from VFW or American Legion. They're doing a swing through Southeast. And for what it's worth, I'll try to share with them how to best get the word out, because not everybody has internet. There are different programs, with the radio, especially in the rural communities. People still listen to the radio.
Yeah.
Like Problem Corner, for instance. Listen to that Capital Chat.
Yeah.
And so what I encourage people to do is, if they're coming in, I'll share this with somebody from the American Legion or VFW. If they're coming in and if they contact me, I encourage them to do that, because people listen to those programs.
Yeah.
And I've got a friend that lives in New Zealand. He dials up and listens to KIMY just to hear Problem Corner from time to time.
It's pretty entertaining.
It is. And that's what that's what it comes down to, is getting the information out. Having the town hall meetings is another thing. And I think we've all seen where we've had big turnouts and small turnouts. Was ever on somebody's agenda that night? Maybe they're busy. School this time of year. We just dropped a nephew off to his basketball practice. He's second grader, third grader, and Kate were able to come by here. And when I see the information, what I'll do is I'll share it with people I know, and encourage them to share it.
Yeah.
And And that's what it takes is, you know, getting the word out and being persistent, because it's easy to get sidetracked by life. You know, and that's it. And so these are, you know, good opportunities. And then you also do some on air.
Yeah, we do a statewide teletown hall for all veterans once a quarter. And then we also do one that's focused specifically for our women veterans. So we're making sure that the topics are really relevant. And I think that, that we moved to a new platform. And so we get on average somewhere around 500 to 800 veterans dialing in from across the state. And so I think it's really a great modality to share common concerns or common information to make sure everyone has what's going on with the Alaska VA or their benefits in general. We do that in partnership with my counterpart, the Director for Veteran Benefits, as well as the state, so that we're sharing information that's very broad and very important to everyone, so that then they can then share that with fellow veterans that might have missed the call. And then, in addition, we open it up for questions. You know, people have rub points that maybe it was a little hard to get that referral in community care, or maybe there was an issue associated with getting the medication that we talked about. We can then share that best practice on how to interface. And then if we need to, instead of walking through someone's personal business, we have people who collect the information and we personally get back to them, solve their problem. With that, go ahead, sir.
Another thing I'd like to share was, you know, I've encountered people who, male and female, women would go, I'm female, can I be a vet? Am I a vet? They didn't realize that. And some men who have not been in a combat zone, you know, they wonder, you know, a lot of times people equate it that either you're male or you've had to be in combat. You know, if you put on that uniform and you serve, you know, you're a veteran. And time and again, that's what we need to, you know, share that.
Right.
And I just had the opportunity yesterday. I was at an event in Linwood, Washington, and I talked with a young lady who was a veteran, and so we got a chance to talk more. And I've you know, had that happen time and again. I'll be involved with the TBR program and just, you know, business in general, you know, finding out people. And that's a big thing as far as, you know, getting the word out with town hall, or, you know, if it's anything, you know, post anything on Facebook, but getting that information out in the communities.
Yeah.
You know, spreading word, you know, asking somebody if they've heard about it. I know one of the things I did is, you know, sent a photo of the town hall meeting and sent it by email, and then I followed up with people I knew that I thought should be here with a text as a little reminder. But again, like I said, life gets in the way, and sometimes you just don't.
No, absolutely, and I appreciate you doing that, because sometimes, you know, while we may have a different commitment tonight, the next time that encouragement will help them understand that there are people who believe that the VA has an ability to support them, and there's also a mechanism and a means to know that there are resources out there, and maybe the next meeting will be a better one for them, or maybe there'll be another connection point we can make with it. Yeah, and so I think that as we head into the holidays, certainly, Juan, I want to thank you for your service as a veteran. I want to thank your husband for his service as well. Not everyone serves. You know, life gets in the way of that too. But some people raise their hand, and all of us who raised the hand knew that there were risks that could potentially befall us. And certainly, as we head into Veterans Day, I want to thank our veterans in Southeast for the commitment that they had. We're a better place for the service of those who came before us. And so thank you very much for what you've done.
And I think we also need to remember to thank the families who provide that support.
Absolutely.
Because, you know, that's key. You know, you're here representing your husband.
Absolutely.
Okay, and that, you know, so that's crucial that you do that, because, you know, it's appropriate that the veterans thank, but it's very appropriate that the network and the family is there.
Absolutely,
So-
because you served too. When your husband served, there were things that you had to do or support, whether you wanted to or not. When he signed,
Well, that's a fact.
right? And he did. I mean, my wife had the same. My children had the same. When one serves, the family serves, and there's issues when we come back from experiences and our family don't know how to relate to us. That family's serving, and we need to make sure that we're taking care of that family unit.
Can I mention something that's
Sure.
not VA related, but a source that was very helpful to me at one time?
Mhm.
Have you ever heard of Patience Mason? She, Mason, her husband was a helicopter pilot in Vietnam.
Okay.
And she has a blog and has written a lot, and she pioneered a lot of help for PTSD when it wasn't called that. And anyway, it's a tremendous resource for people. If you know of anyone or a family member who deals with that. Patience Mason did a lot of groundbreaking work just figuring it out for themselves.
Mhm.
And Patience Mason is her name. You just Google it. And,
Thanks.
it was super helpful to me. And not the usual stuff. It's just, anyway, very helpful.
No, I appreciate that. It's all about connecting resources, and it takes a lot of different resources to potentially provide the right one to the person who needs it.
Yeah.
And so thanks for sharing that.
Yeah.
All right. Well, I want to thank you for coming up. If you have any one-on-one comments or concerns, certainly want to make sure that before you leave that I have them captured, and I have yours.
Yes, you have all
So
my
I'm
notes.
good to go there. But
Thank you.
again, thank you very much.
Yeah, thanks for coming out, everybody. Thank you.
Thank you.
Thank you. And Sam, thanks. I'll call you or email
I got
you
you.
on Monday.
Yep, make sure I get your emails, I'll put it on that email distribution.
Yeah, did
What
I
he was
give you my
talking about.
email? Oh, yeah, well,
Yeah, you're gonna send it to
sounds
me.
good. Yeah. That's how that works.
Right, so on our gov.delivery, we have a little over 18,000 people.
Yeah.
On the
Position.